The universe is wider than our views of it. The use of central venous access devices, CVADs, presents a significant risk for infections and thrombosis. The study aimed to investigate whether 4% Tetrasodium EDTA, TEDTA, known for its anticoagulant and antimicrobial properties, could reduce CVAD-related complications. This was a pragmatic, triple-blind, multi-center trial with a cluster randomized crossover design involving 1468 ICU patients aged over 18 years. Participants received either 2.5 milliliters of TEDTA or a control solution, saline or 4% citrate, as a CVAD locking fluid across a 3.5-month period, followed by a crossover to the alternate solution. The primary endpoint was the composite incidence rate of bloodstream infections, catheter occlusions, or removals due to occlusion over a follow-up period of 1 month.
Quick take. This trial evaluated the efficacy of 4% tetrasodium EDTA in reducing CVAD-associated complications in ICU patients by comparing it against control solutions.
The primary outcome incidence was significantly lower in the TEDTA group at 13.1 per thousand catheter days compared to 19.9 in the control. Adjusted analysis showed a reduced incidence rate ratio of 0.68 for the TEDTA group. Notably, the reduction in CVAD occlusion requiring alteplase differed significantly, with rates of 11.67 versus 17.73 per 1,000 catheter days between the groups. The authors conclude that utilizing 4% TEDTA as a locking solution in CVAD significantly reduces the risk of bloodstream infections, catheter occlusions, and removals due to occlusion in ICU settings.
Quick take. Using 4% tetrasodium EDTA significantly lowered complications related to CVADs, showcasing its potential in ICUs to reduce infection and occlusion rates.
Short quiz, clinical vignette. Question. A 60-year-old ICU patient with a CVAD is monitored for thrombosis and infection risk. The catheter occlusion rate drops after introducing a new locking fluid. Which fluid was most likely used? Option A is 4% tetrasodium EDTA. Option B is normal saline. Option C is 4% citrate. Option D is heparin.
The answer is option A. The study demonstrated that 4% tetrasodium EDTA, utilized as a locking fluid, significantly reduced CVAD-related complications compared to saline or citrate.